Have you ever gotten up in the morning feeling more weary than when you went to bed? Or maybe you've noticed that your joints hurt more, or that you forget things more often as you get older. Many of us have these health problems, but here's the thing. You can be making them worse every time you sit down to eat. Yes, some foods, especially veggies, can raise your chance of significant health problems like stroke. The worst part is that you might be eating them every day without even knowing it. Now think about this. Something as easy and ubiquitous as your regular food could be making you more likely to have a stroke, maybe even overnight. What kind of vegetable is this, and why is it so bad for older people? Stay with me. The next few minutes could change the way you think about food for the rest of your life. Welcome if you're new here. This channel is just for seniors, and every week we provide you natural treatments, medical advice, and lifestyle suggestions to help you digest better, protect your heart, strengthen your bones, improve your memory, and boost your energy. When you subscribe, you'll get expert guidance that is easy to comprehend and will help you live a healthier, happier, and more independent life after 60. So click the subscribe button and switch on notifications. You won't want to miss what's coming next. The unknown vegetable. What kind of veggie am I talking about? It's spinach. You might be wondering, spinach? But it's good for you. And you're completely right. Many people think that spinach is one of the healthiest vegetables on the globe, since it is full of vitamins, minerals, and antioxidants that are good for your body. Spinach is known for its many health benefits, such as boosting immunity and helping digestion. It is full of vitamin A, vitamin C, folate, iron, calcium, and fiber. But here's the twist. Spinach has a lot of vitamin K, which can be bad for some older people. You've certainly heard a lot about how good vitamin K is for your bones and blood clotting, but if you take a lot of it, it might be dangerous, especially if you're on certain medicines. What is the problem with vitamin K for older people? Vitamin K is very important for blood clotting because it helps your body make proteins that help blood clot properly. Vitamin K helps stop too much bleeding when you get cut or hurt, but only in the right proportions. It is an important ingredient for keeping your blood flowing and healing. But vitamin K can make blood thinning medications like warfarin less effective for patients who use them. Warfarin, for instance, stops vitamin K from working, which helps keep blood from clotting too quickly. But eating a lot of food strong in vitamin K, like spinach, can make the medicine less effective and raise the risk of blood clots. And what happens when you get blood clots? You could be more likely to have a stroke, which is why it's crucial to know how vitamin K and blood thinners work together. How much spinach is too much? You might be wondering how much spinach is okay to eat. There is no one-size-fits-all solution, but here is a general rule. If you maintain a balanced diet and don't have any problems with blood clotting or medications, it's good to eat spinach once or twice a week. The trouble starts when people eat a lot of spinach every day. This is especially dangerous for older people who take blood thinners or have other health problems. Let's look at it in a different way. Think of spinach as a terrific tool, like a strong car. It can do amazing things if you use it right. But if you push the car too hard without taking care of it, you could have some big problems. In the same way, if you eat spinach every day without keeping track of how much vitamin K you get, you could be putting your health at risk without even knowing it. You might be making your body an environment that makes clotting more likely without even knowing it, which could put you at risk for stroke or other heart problems. A hidden threat in your kitchen. It's like there's a hidden threat in your kitchen. You believe you're eating something nutritious and safe, but it could be slowly upping your risk of having a stroke. The problem is that we commonly eat salads, smoothies, or cooked meals that contain spinach and other foods high in vitamin K without thinking about the consequences. And it's not just the vitamin K concentration that makes spinach bad for you when you eat too much of it, especially for older people. I'll explain that in a minute. How to enjoy spinach safely. A practical tip. Here is how to consume spinach safely if you love it and don't want to give it up. It's important to be moderate. Instead of eating spinach every day, consider eating it a couple of times a week. You can also balance it out with other vegetables that are high in nutrients but low in vitamin K. Apples, bananas, cucumbers, bell peppers, and carrots are all great foods to eat with spinach because they give you a lot of nutrients without adding too much vitamin K to your body. If you take blood thinners or any other medication that affects how well your blood clots, you should always talk to your doctor or dietitian about how much spinach is safe for you to eat. You might also want to keep an eye on how much vitamin K you get and make sure it fits with your treatment plan. Cooking spinach is also a good idea. Cooking spinach can make it easier to digest and lower the amount of oxalates, which are another chemical in spinach that can cause kidney stones. But be careful about how much you consume and make sure you eat it as part of a healthy, balanced diet. Do you eat spinach often? Have you seen any changes in your health since you started eating it? Or, if you use blood thinners, have you ever been told to eat less spinach? Please tell me about your experiences in the comments below. The risk factor for stroke. So what is it about vitamin K that makes your risk of having a stroke go up? To understand this, we need to look more closely at how vitamin K affects your blood and circulation. As you can see, vitamin K is very important for blood clotting. It helps your body make some proteins that help blood clot when it needs to, such as when you get a cut or hurt. This is an important job that keeps bleeding from getting too bad. But if you are already at risk for blood clots or have circulation problems, eating a lot of vitamin K on a regular basis can be bad for you. If you're taking blood thinners like warfarin, which is what doctors give you to stop blood clots, the relationship with vitamin K gets even more convoluted. Warfarin stops vitamin K from working, which makes it difficult for blood to clot. This is why people with certain conditions like atrial fibrillation or a history of blood clots can lower their risk of having a stroke or heart attack by taking blood-thinning medications. But here's the problem. Taking a lot of vitamin K can make these drugs less effective by canceling out their effects. In short, you might be making it so that your blood clots more than it should, which can greatly increase your risk of a stroke. Let's look at it in terms of something we all know. Imagine your blood vessels as a river. Think of the water of the river flowing smoothly, without any bumps or obstructions. This is how your blood should ideally flow through your arteries and veins. When everything is operating right, your blood is flowing easily and oxygen is getting to your organs and tissues. Now, let's say you start putting rocks, branches, and other junk into the river. The water starts to move quicker, and some parts of the river get obstructed. Some parts of the river may even start to form dangerous pools where water could get trapped. Over time, this could lead to the formation of a dam. The effect is a flow that is not smooth, which is what happens when your blood clots too much. In this example, vitamin K is like the debris that stops blood from flowing smoothly. You could be blocking the flow of blood in your arteries if you eat too much vitamin K, especially in the form of spinach and other foods strong in vitamin K. This can lead to blood clots. Blood clots can also move to the brain and limit the passage of oxygen to critical areas, which can cause a stroke. Understanding the risk for older people. This is especially worrying for older people. As we become older, our blood flow and heart health gradually go worse. The walls of our arteries may get thicker and stiffer, which makes it harder for blood to flow freely. If you already have health problems like high blood pressure or high cholesterol, the situation gets much worse. Vitamin K can make these problems worse by making the blood clot more easily, which makes it more likely that a clot will form and obstruct blood supply to the brain, which can lead to a stroke. Older people are also more likely to have these clotting problems because of the medications they take for long-term health problems. A lot of older people take blood thinners, blood pressure medicines, or cholesterol-lowering pharmaceuticals. These medicines are important for treating a number of health issues, but they also need a careful diet. Getting too much vitamin K from spinach or other leafy greens could throw off that balance and raise the risk of a stroke. But here's something most people don't know. Spinach isn't just bad for you because it has vitamin K. There are other chemicals in this vegetable that could be harmful for older people, especially if they eat a lot of it on a daily basis. Stay with me, because in a minute, I'm going to tell you about the other things in spinach that could be bad for your health. Have you or someone you know been told to cut back on foods that are high in vitamin K? How do you make sure you don't get too much vitamin K in your meals? Please leave a comment with your thoughts and experiences. The secret ingredients in spinach. Spinach has oxalates in it in addition to vitamin K. These can be harmful, especially for older people. Oxalates are naturally present chemicals that are found in many plant-based foods. They can be good for your health, but eating too much of them can be bad for you. One of the biggest problems with oxalates is that they could stop your body from absorbing calcium. Oxalates and calcium can stick together to form crystals that don't dissolve. Over time, these crystals can build up and turn into kidney stones. But here's the thing. Oxalates don't just hurt your kidneys. Oxalates in the blood can also cause problems with blood vessels, which can raise the risk of strokes. So even though spinach may look like a good food choice, it has a secret chemical that could be hurting you in ways you don't expect. Why oxalates are especially bad for older people. As we get older, our bodies don't always work as well as they used to. Seniors are more likely than other people to not get enough calcium, which can make their bones weaker and cause problems like osteoarthritis. Calcium is very important for keeping bones healthy and the body working properly. Anything that makes it hard for the body to absorb calcium, like oxalates, can be a big problem. Eating a lot of oxalates can cause them to build up in the kidneys and create calcium oxalate kidney stones. These stones can hurt a lot and be hard to get rid of. In some circumstances, surgery is needed to get rid of them. But the risk doesn't end there. If oxalates are making it harder for the body to absorb calcium, they can also make bones weaker, which can cause more problems like osteoporosis, which raises the chance of fractures. The link between oxalates and the risk of stroke. This is when things become even worse. Oxalates don't merely build up in the kidneys and bones. Research indicates that elevated oxalate concentrations in the bloodstream may lead to vascular complications, which are directly associated with strokes. Oxalates can stick to calcium in the blood vessels, which can cause crystals to develop in the arteries. Over time, this can make the blood vessels narrower and stiffer, which makes it more likely that a clot will develop and obstruct blood flow to the brain. Let's use an example to make this clear. Picture two persons. One person eats spinach every day and a lot of items that have oxalate in them. Their bodies slowly build up these oxalates, which can cause kidney stones and make their bones weaker. When oxalates build up in their blood, they also raise their risk of vascular issues, which could lead to a stroke. On the other hand, think about someone who only eats spinach a few times a week and switches it out with low oxalate veggies like lettuce, arugula, or kale. They're still getting the nutrients they need from spinach, but they're not getting too many oxalates. This person might still get the health benefits of spinach without the hazards that come with eating it for a long time. Eating spinach every day might seem like a good idea, but if you don't watch out, it could backfire because it has oxalates that can make you sick. You could be putting your kidneys and blood vessels at risk without even knowing it if you don't know how oxalates affect your body. If you want to keep oxalates from building up in your body, try eating spinach with foods high in calcium, including yogurt, cheese, or milk. Calcium can help balance out the effects of oxalates, so you can still obtain the health benefits of spinach without worrying about getting kidney stones or other problems. You can also change the order of your grains. Instead of eating spinach every day, consider switching it up with other leafy grains that have less oxalates, including arugula, kale, or lettuce. These other options will still give you the nutrients you need, but they won't have the extra risk that come with high oxalate levels. How often do you have spinach? Do you know anyone who eats it every day or uses it as a go-to vegetable in their meals? What do you think about the potential risks of spinach, like vitamin K and oxalates? Please leave a comment below and let me know what you think about this. Foods that help spinach stay balanced. If you love spinach but don't want to give it up completely, the good news is you can eat it with other foods to reduce its risks, especially when it comes to preventing strokes and improving heart health. You may get the health benefits of spinach without hurting your blood vessels if you eat it with the right foods. 1. Foods high in vitamin E. Anything high in vitamin E is a great item to eat with spinach.
This powerful antioxidant can increase blood flow, stop clots from forming, and even reduce the oxidative stress that can damage your blood vessels. Nuts, almonds, walnuts, hazelnuts, seeds, sunflower seeds, chia seeds, and avocados are all great sources of vitamin E. Vitamin E is very important because it's a natural blood thinner that helps your blood flow smoothly and stops the clotting effects of too much vitamin K in spinach. Vitamin E helps blood flow and reduces the risk of blood clots when it's mixed with spinach. Garlic is another item that goes well with spinach. Garlic has been shown to be good for the heart in several ways, including making blood flow better, lowering cholesterol levels, and naturally thinning the blood. Some studies have even shown that garlic may help keep arteries from stiffening, a condition called atherosclerosis, which is closely linked to the risk of stroke. Adding garlic to spinach makes a meal that is good for your heart and blood flow and helps keep your blood vessels healthy. Garlic not only helps blood flow, but it also goes well with spinach because it lessens the bad effects of vitamin K's clotting effect. This keeps your heart and blood vessels as healthy as possible. So let's look at how this works in more detail. If you consume spinach without adding foods high in vitamin E, like almonds or garlic, you may be more likely to have a stroke because your blood clots too easily or doesn't flow well. But if you eat these foods that thin your blood and improve your circulation, you're doing the right things to keep your vascular health strong, not hurt it. In this situation, you're helping your body metabolize the spinach in a way that keeps blood flow smoothly, which lowers the likelihood of any bad side effects. Think of it like putting together the right blend of ingredients to make a recipe work. When you eat spinach with the right foods, it becomes a healthy meal that improves your body instead of putting it at risk. If you love spinach but want to be sure you're taking care of your heart, try making a spinach salad with avocado, almonds, and roasted garlic. For more flavor, add a squeeze of lemon and a drizzle of olive oil, which is another healthy fat that helps blood flow. These other foods will not only give you the health benefits of spinach, but they will also help your heart. Don't forget that moderation is important. Try eating spinach once or twice a week, but make sure to eat other foods that help blood flow as well. This approach makes sure you get all the benefits without putting your body at too much risk. Do you eat spinach often? Have you seen any changes in your health since you started eating it? You might have noticed that eating it with other foods like garlic or nuts helps you feel better overall. Please leave a comment below and tell me your experiences and any other food pairings that you think are good for heart health. The big picture: eating well to prevent strokes. Now let's take a step back and look at how your food as a whole can help prevent strokes. It's important to be careful with more than just spinach when it comes to your risk of having a stroke. A lot of common foods like processed meats, sugary drinks, and snacks with a high salt content can also make you more likely to have a stroke. It's important to not focus on just one meal, but on the quality of your whole diet. Studies suggest that older adults who eat a lot of fruits, vegetables, whole grains, and lean proteins are much less likely to have a stroke than those who eat a lot of processed foods, harmful fats, and sugars. So, spinach does have some risks, but the key is to make better choices in general. A diet that is good for your heart can help you avoid having a stroke. You can prevent yourself from strokes by adding these simple, ordinary foods to your diet. Are you curious about what these foods are and how they protect your heart? I'm going to tell you about some more easy-to-find foods that are good for your heart and can help your health in a huge way. What do you think about adding these foods that are good for your heart to your diet? If you've already tried any of these foods, how do you think they've affected your health? Please leave a comment below. I'd love to hear what you think and any advice you have for preventing strokes. In short, spinach is a healthy food full of nutrients, but eating much of it, especially for older people on blood thinners, can make you more likely to have a stroke. You can enjoy the benefits of spinach without the risk if you eat it in moderation and mix it with other heart-healthy foods like garlic, almonds high in vitamin E, and low oxalate vegetables. Please like, share, and subscribe if you like this video. By signing up, you'll keep getting weekly recommendations developed specifically for seniors that can help you live longer, healthier, and happier. After the age of 60, take care of your health. And if you're worried about your diet and the risk of a stroke, don't forget to talk to your doctor. Remember that your health is your most valuable asset, and we're here to help you protect it at every turn. We'll see you with some more tips next week.